America's Healthcare Challenge with Sean McGuire.
When you look at how the coronavirus has played out over the last couple of weeks, you kind of got two camps. Some people like me who initially kind of was more of a skeptic and thought that, oh, this is kind of hyped up a little bit. And other people who are truly on top of things based upon their experience kind of sounded the alarm a little bit more and said, Sean, you know what, this is a bigger thing. And I want to bring in our co-host of America's Healthcare Challenge, Alan Hager. It's great to see you. Hey, I see a LSU banner back there. Are you providing a little subtle, hints back there?
Oh, no.
Congratulations on your national championship. Hopefully the teams will be able to play, this fall. We'll talk a little bit more about that.
Well, and it's a banner. I'm happy that they won. I'm glad to be here. I'm glad to talk with you about the crisis that we have in our country and the public health challenges that we're going to face.
Yeah, thanks so much for taking time out of your busy schedule to
Absolutely.
help provide a public service to everybody. We've been trying to follow this closely. We've been talking, I guess, the past couple of days, almost every hour about these things. You've been talking to a lot of people in the know in Nebraska. The governor just held a press conference. You mentioned that you talked to Senator Sass a little bit about this issue. Why don't you tell the listeners first a little bit about your background in managing this through some of your public services, and then we'll kind of get into some of the facts going on around this illness, and we'll take a look at this map for the viewers to be able to see kind of how quickly this is spreading.
Okay, so for 15 years, I've worked for CHI in healthcare IT at different levels in management and whatnot. For 5 years, during that time, I service gave me a good insight into public health, what we do in times of crisis and public, national, state, local emergencies. I was vice chair of the medical board. We did tabletops. We do live drills. So, for example, when we had the Katrina stuff back in 2005, 2008, excuse me, we took care of a lot of the things that would be needed to be done, like centralizing communication and being able to communicate to all the hospitals on how many different patients they were going to receive, how critical those patients were, what type of stockpiles do we have of specific items in our arsenal. And we would have delivery people going into those stockpiles to get things to the hospitals that needed things. So as far as response in that regard, I'm excited. I think that it's a really good opportunity to see OMERS and our medical community in action, because we're going to be on the front lines of this. I also sit on an education board, and we've been trying to make decisions from paying our hourly staffers to, are we even going to be open? And a lot of what the governor talked about today centered around a lot of those things that, will these buildings be open for community use? Will they be used for students to come in and families to come in? Will they be used for whatnot? And so, that's given me a different insight into just the level of communication between all the different agencies across our state.
One of the things that I've been, concerned about as we've watched things unfold is how the different levels of government, again, we're both political junkies. I think the viewers know that.
Right.
But the differences between the federal, the state, and the local governments and their response. President just now is in the midst of declaring a national emergency on this issue.
Right.
Do you think these governments are prepared enough? How do you see this issue as a rural versus urban issue, in that maybe cities like Omaha might be more equipped to better handle something like this compared to other counterparts out west, for example.
Right. So let's break that down a little bit, because there's a lot of information there and a lot of different things to unpack. So I'll take the last part of it first. And you're absolutely right when it comes to urban versus rural and the differences, not just in levels of readiness. Are rural hospitals able to handle the influx of patients that they're going to see in a pandemic like this?
Right.
Do they have enough respirators and other gowns and gloves and hand sanitizer and soap and other things that we take for granted? Are they going to have the stockpiles needed? Because we're seeing shortages all over the country in all of those things already. Now, I talked about OMERs and being able to deliver out of the stockpile items. I'm fairly confident that we do have a good stockpile, but if this thing goes for a long time, 6, 8, 12, 24 weeks, you start running short on those things. And if you start seeing your staff not being able to come in to work or get stuck at work and not getting sick, and you have a shortage of staff, how is that going to impact the rural community, per se, more so than maybe the urban community, where, maybe I have 40% of my beds are open, but I don't have enough nurses on one floor. Maybe I can move nurses around. Maybe I can train more nurses. There's more flexibility in that regard, I think, in the urban area. But at the same time, if we don't have the necessary PPE, protective personal equipment, it's not going to matter, because they're going to get infected, and we're going to run into shortages of staff, which we already have, just given the numbers of doctors and nurses versus the numbers that we really need. So, the local area is fine. State, I think you start to get a little bit more complicated, because you got to have legislative impact and legislative things being done. For example, certain boards want to meet because they need to give clearance to their staff to allow for hourly employees to be paid. Well, due to open meetings laws in the state of Nebraska, we can't do that just by a video call. We have to meet face to face. Well, if we're in a pandemic, is that the best thing to do? So we've talked about that with the legislature. I know other agencies and other government bodies have done the same, because we don't want those who are at the lower end of the wage scale to be impacted, because they're the least able to handle being out of work for 6 or 8 weeks. So we can't afford that. So, from an economic perspective, that is something that I have been very much on top of since last week, when I've started talking with my CEO about what we are doing for the pandemic, because I view that it would get worse. I think that the federal government has failed. I don't want them to fail, because they are the experts in pandemic and infectious disease. Dr. Fauci has talked all the time about we don't have enough tests, and telling Congress that we don't have enough tests. And he is the expert on infectious disease in our country. He is the most knowledgeable, most well-respected person in the field. And when he talks, we should listen.
I wanted to pull up this screen here so
okay,
the viewers can see. Can you see it, Alan?
Yes, I can.
Just thought we'd kind of react a little bit. I guess you kind of have to imagine the continents, but this would be the United States, this would be Europe, and this would be Asia over
Correct.
here, South America down here.
Yes.
When you look at this, Alan, a couple days ago, you were this is when we were talking. You were saying we ain't seen nothing yet, and
Right.
then wasn't much longer after that when I think the catalyst of all of this was Rudy Gobert for the Utah Jazz getting diagnosed, and I mean
Right.
that really launched the dominoes, and it's just been a domino effect since then.
Right. And
With sports and now other events, and
right. And
you wonder if we're living in an alternate universe some days, or if like this is a movie, like I said before, that if this is are we living in a movie?
right. Well, I would tell you, I think that it just shows how interconnected we all are across the globe. I think that whether it's the global supply chain that we have that's being impacted, a lot of business is done by travel. We go to Asia, we go to Europe to sell our wares and to make deals with those that have the supply chain. And maybe that's a shortcoming of globalism and the global economy. Because when you look at where the most cases are at, with the exception of maybe Wuhan, a lot of it is coastal communities. A lot of the large impacts are East Coast, West Coast. Italy is a island. It's a boot. It's a peninsula, so to speak. And so there's a lot of ports there, and I think that it just shows how we as a world are interconnected. When you see how the spiral of dominoes are, it usually is the interior parts of the country that get hit last with these things. And I think you see that playing out with the way the map is going and how everything is moving inland.
So how far along do you think we are with all this? Are we just in the beginning phases, or?
I think you look at things and we really are probably, I would say, 3-4 weeks into this thing. I think, we weren't quite sure. And again, China taking 5 weeks to really let the rest of the world know what was going on is one thing. I think the fact that some of our global pandemic team that resides in some of these countries where we have known infectious disease not being there has contributed as well to a lack of a response from the globe, not just the United States, but from other countries. And I think that it, again, shows how dependent the world is on the United States and our amazing experts in infectious disease at the CDC and other parts of our government.
One of the myths I've heard out there, there's a lot of rumors going on around this.
Right.
Was this potentially a bioweapon? I watched an interview, Joe Rogan. I enjoy his podcast sometimes, and he had an authority on about this issue. And
right.
He said that this thing is Mother Nature created something that was like, with this coronavirus, is more well thought out than any bioweapon could have ever been thought out. In that,
right,
it's beyond what the bad guys could have ever even dreamt up.
And I don't know that it was a bio attack. I mean, I'm still very skeptical of the conspiracies that are all going around. But the fact that it's hitting adults mainly, kids can be carriers, but they're not showing symptoms, and they're asymptomatic, and they're carriers, but they're not the ones that are seeing the symptoms come out of. and that it's only really affecting adults. I can't say that we've seen a illness that's ever been this interesting from a epidemiology perspective.
Yeah. Yes, they'll be studying this for a very long time, and
Yes.
it's something that, you know, we're going to conclude our conversation with talking about health reform 2.0, because I can't imagine that this is only going to be the last time we're going to face something like this. So,
Right.
how do we, as we move past this, again, we're just getting started, but as we move past this, how can we learn from this and turn it into something that can somehow be a positive? And how do we introduce this whole rally around the flag concept for this issue, and get these politicians to put politics aside and really get down and focus on this and deal with issues like the fact that how do we spend a sixth of our economy on healthcare and not have enough testing kits, for example?
Right. So I think there's multiple things. First off, let's deal with the politics side of things. It's a generational thing. When you see who's fighting, it's not the young people that are sitting there yelling and screaming, saying, we don't want this, but we want this. And so when you look at the political side of it, I think you see a real generational thing here where you've got, and it's a lot of baby boomers. I mean, let's be honest, it's a lot of baby boomers that are in these positions of power. They haven't retired, and they're hanging on. They're grasping to the last clutches of power, and both sides are fighting, and they're taking it to the nth degree. And when you go back to the 90s and fast forward up, you know, you had Clinton versus the Republicans, Bush versus Democrats, Obama versus Republicans, Trump versus Democrats, and they're all the old guys. The old guard are all trying to hang on for power, and they're fighting amongst each other. Well, it's time to let's move forward with a new generation of leaders that are willing to put party aside, put country first, put their fellow man first, and say enough of this shenanigans, and we're going to work for the betterment of America. And I think that we need to see that at every level of government, that we need to say, you know what, we're facing a crisis here, folks. We need to come together, put party aside, put country first, put our fellow man first, and find solutions to these problems, whether it's Social Security, Medicare, Medicaid. Dude, we're in a situation now where who cares about the other stuff? We got to save humanity here. We need to be supportive of our local businesses. And we also need to say that those hourly employees, whether you're a restaurateur or a bartender or a barback or a waiter or a waitress or whatever, if you're sick, you're going to get paid. Let's find solutions and become, work together as a community so that these hourly employees in the service industries, especially, who are going to be impacted the most, are taken care of.
That's Alan Hager. Thanks so much for joining us. What's your Twitter handle?
He's seen on Twitter at Real Alan Hager.
He is the Real Alan Hager, keeping it real. As always, great to see you.
Great to see you.
Thanks so much for sharing your time. We'll be checking in with you soon.
Great. Thank you, Sean. And just everybody stay safe out there. Wash your hands. And